COVID-19 is undoubtedly going to change the way that we practice medicine in the future, and I think in very positive ways. It's driven a real recognition of the importance of deep collaboration between public health and medicine. This is a global pandemic. It's not just a local pandemic, and it affects everyone in our community, and we're having to rethink what our healthcare systems, how they work, how they provide healthcare to every member of the community. I've been most inspired by the coming together of our students to assemble face shields, which are used as personal protective equipment in the hospital and in the clinics for healthcare workers. And our donors have very generously provided materials with which we can make these face shields. And what the students did is they organized themselves so that they could work in teams to assemble the face shields and deliver them to our hospitals here at UCLA, but also at our affiliate sites.
With the pandemic, we suddenly had people who didn't have family around who were probably going to die. But the first time I heard about it was up on the 8th floor. And when I went upstairs to talk to the unit director, she said, "Don't worry, we won't let him die alone." And nurses stayed past their shifts on their own time with that patient until that patient passed. While that was really wonderful that they did that, that wasn't good enough for us, because how do we get the people that patients know close to them when they can't be with them and they're passing? We took our iPads and we found a way to use telehealth visit Zooming to bring families into the room with their COVID-affected family members. And what the nurse did was she said, no, wait a minute, before they started to do the procedure. She ran out and got the iPad, zoomed in the wife, and had the wife's voice and face the first things that that patient heard and saw when they woke up. It says a lot for this organization. It says a lot for our attention to and inclusion of their families in the community and all we do. And wouldn't trade this place for the world.
So UCLA's really been a major player in the treatment of HIV since the beginning. The first case of HIV was described at UCLA, and research into understanding the virus, the pathogenesis, and finding new treatments have been occurring at UCLA for over 30 years. The infrastructure that was built around HIV in the conduct of these studies was rapidly pivoted to address COVID-19. And this is from the laboratory research to the clinical research. So having these things in place really helped us be able to rapidly both study the virus, measure it, develop ways of testing for it, looking at antibody responses to it, and concurrently implementing clinical trials to test new treatments as quickly as possible.
Depression affects more than 320 million people worldwide, and the rates are increasing, especially among younger people. It's the leading cause of disability and projected to soon be the major contributor to global disease burden. To understand and treat depression, we need to study it from all angles, from cells to brain to behavior, in large samples and over long periods of time. And that is exactly what the Depression Grand Challenge is aiming to do. And UCLA is the exact right place to do it because it is a force of science.
COVID-19 has been a challenge for us because the primary focus of our work is making that connection with the people and the animals and bringing the animals to the people. We're resilient, our volunteers are wonderful. We've managed to provide comfort in the form of video comfort messages. We are now doing virtual visits to patients, and we've expanded that outreach to UCLA staff and students. So the call started off with Victoria explaining to Daniel, the little boy, how Blue Moon provides comfort to patients in the hospital. And the boy looked at Victoria and said, well, how do you provide comfort to Blue Moon when she's not feeling well? And this story still gets me choked up because to hear that come from a 4-year-old was fantastic. It's just really wonderful to be able to see these interactions happen even though we're not in person.